Good morning, everybody, and welcome back to your Lunch Break Live. Today is Tuesday, and my name is Ivana if you are new here. And if you are new here, you might be getting a little dizzy from your screen. We got a lot more people here than usual, but it is for good reason. Today, we're talking about a serious topic, and that is the coronavirus vaccines. We know that we got some of our first shipments of the vaccine to Alabama yesterday. We got some more today. Today, I am joined by our own reporters. I've got John Sharp here on top with right next to me. I've got Lee Root and Dennis Pillion down below. And now John Sharp is our Mobile-based reporter. Lee is our Huntsville-based reporter. And Dennis is our Birmingham-based reporter. So I had that graphic. I took it down so you could see the gentleman here on bottom. And there are different plans for different areas of the state. There's a lot of different information for different hospitals, for different cities. So I thought it would be useful to all get on here today, talk about what is happening in each area of the state and answer any questions that you might have. So now let's see, Lee, I'll start with you. We'll talk about Huntsville. I know this is an ever-evolving situation, but one thing that we do know with most certainty is that the Alabama Department of Public Health said on Monday that the first 3 hospitals got their vaccines. Tuesday morning, this morning, there were other hospitals expected to get those vaccines, and there should be 15 hospitals in total that are going to get a combined total of 40,950 doses. It sounds like a lot of doses, but in reality, it's not. Lee, tell us how many are coming to Huntsville and what the plan is for vaccinations in the Huntsville region.
Sure. They told us at the hospital yesterday that Huntsville will be getting 6,825 doses. So that's pretty specific. We've done some other reporting on AL.com that says about half of those will go hospital workers, care workers, and then EMS, physicians' offices, other hospital staff, and that's the breakdown they're going to follow here. Huntsville Hospital is a big system. They have hospitals all across North Alabama. So they'll be sharing them out to their partner hospitals like Decatur and places like that as well. They weren't supposed to the vaccine wasn't supposed to arrive here until this morning. And it is the Pfizer vaccine, which means they'll have to circle back and have the booster in 21 days. So it looks like everything is on track. They've done a lot of tabletop gaming about how to do it, how to get it out, who should get it, first. Kind of interesting. One of the most interesting things to me was they did a survey. Let me see, about 1,000 employees. Just over half said they would take it, about 50 to 55%. So I thought that was kind of interesting. But when you look at a hospital, there's a huge facilities, and all kinds of folks work there, and all kinds of folks are exposed to the virus closest or farther away. But it was a little less than what I expected. I thought everybody would be lining up to get it, but it seems to be like the rest of the country, maybe 60%.
Mm-hmm. Now, something I thought was interesting in a story you wrote, Lee, and it was about the timeline of getting these vaccinations out. And there was a comment in your story by somebody from the Huntsville Hospital Administration saying they were working on a 2-week time frame to get out those 6,825 doses because they didn't want to vaccinate everybody in case of potential side effects.
Yes, that's right. You have a certain number of people working in a certain department or working at a certain job on a certain shift. If you give everyone the vaccine at the same time, and maybe you have a half a dozen and 2 or 3 have a reaction and maybe have to miss a day or something, all of a sudden you're shorthanded. And so that was sort of the principle there. They'll give a significant percentage of and of course they'll start with the online first line emergency room people, I'm sure, but they won't all get it. just to make sure somebody's there to answer the door, so to speak.
I thought that was fascinating because that's something I wouldn't have thought about. And again, though, that just rolls into all this logistical timeline, this logistical rollout that we haven't had to think about in a long time. And I know that is something that I'm glad I'm not in charge of, because those are the small details that can get missed. Now, I'm going to pivot a little bit and ask you, John, what the situation is down in Mobile. I know, again, situations are changing so fast. We originally thought most of these vaccinations would happen tomorrow. We are getting word that there is, at least maybe in Coleman, going to be their first vaccinations at Coleman happening later on today. And who knows, maybe some more. So these plans are changing. John, what's happening in Mobile?
Yeah, we have 5,800 initial doses coming to Mobile that'll be divided up into 5 hospitals. So we have Mobile Infirmary, University Hospital, USA Children's and Women's Hospital, Providence Hospital, and Spring Hill Medical Center, all facilities based in Mobile. They do have branches that extend out beyond Mobile into Baldwin County. But these hospitals are receiving the initial doses. And for instance, Mobile Infirmary, one of the larger hospitals down here, is going to be getting 1,000 doses this week. And they, just like Lead indicated in Huntsville, will be providing those doses to dosages to healthcare workers, to folks that work at the hospital. Those are in the front line right now of dealing with the coronavirus. So we can anticipate the initial doses being administered at least at the latest tomorrow. But it's very, again, you indicate it's a very fluid situation. So we're still receiving word on when some of this might occur. But from where we're at right now, we're aware of 5,800 initial vaccine doses heading out to Mobile, to the various hospitals in this area. And that's kind of where we're starting. I mean, it'll start in the hospitals, and from there, just like everywhere else, there'll be another phase in which long-term healthcare providers, the nursing homes, will be receiving the vaccine as well.
Let me ask both of you, and then I'll move on to Dennis. But John, Lee, we know, Lee, you said there was a little bit over 6,800, and John, you said about 5,800 of those vaccines, those doses. Now, for both of you, do we know if these doses, these vials, are those 50, let's say 6,800 of first round shots, or do we have to half that to account for that second dose 21 days later? Lee, I'll let you go first.
No, it's my understanding that these are all first round, so they'll all be given as far down the list as they can go, and then they expect to come back and circle back. That's my understanding. I could be wrong, but that's a good question. I think they're going to give them all.
Yeah, Lee, you're correct. This is the first round. Then we'll come back next month for the second round. Also, the storage is very important. That's why some of these particular hospitals are being chosen versus others, is because you got to have the storage at a certain temperature. What is it, negative 70 to 80 degrees Celsius. And that these particular hospitals have the facilities in order to store the vaccine at those temperatures. Otherwise, you run all sorts of problems. And whereas the Moderna vaccine, and Dennis could get into this perhaps a little bit more, does not require that type of temperature. It can be stored at a little bit less extreme temperatures, in which would not require, could extend the options more for more hospitals in order to receive a vaccine.
Right. We know that from the ADPH, they said there was going to be a total of 15 hospitals that would receive the combined total of 40,950 doses. Got a question for all of you, and I believe it's the same answer because this one is a statewide question. This is from Frog, and he asks about that second dose. Are we putting back the enough for a second dose of this vaccine, or are we going to have to get a new shipment of that second dose?
Well, I guess I can kind of jump in there. We've talked to the Department of Public Health about this. It's the Alabama Department of Public Health that is really kind of coordinating this show and making those kinds of decisions. I believe they've said that all of our initial 40,000 doses that we've received for the state are going to be first doses, which to me indicates that they're very confident that within 21 days they'll have enough new shipments come in. And they've said they expected a second shipment, something like a week after the first one, which should still be plenty of time to distribute out to these hospitals for those 21-day follow-ups.
Thank you, Dennis Frog. I hope that answers your question. And I have another interesting question I want to get in. But first, Dennis, let's talk about Birmingham. Now, we know that in Birmingham, University of Alabama at Birmingham, UAB Hospital was one that I believe last week said they thought they might be one of the only places in the county, in Jefferson County, to get that vaccine. So we know at UAB, and this is not for all of Birmingham, but at UAB, there were 10,725 doses that were delivered to the hospital. We got that information from UAB directly. We know that they are planning to give out their first vaccines on Wednesday morning. That seemed to be kind of an initial timeline for a lot of our hospitals across the state. Now, Dennis, what do we know about that plan?
Yeah, so we know UAB, I believe that it's 10,725 first doses that they received. And that's not only for the healthcare workers at UAB, but also other medical facilities within a certain radius of UAB. They're going to, I believe, send the personnel to UAB to receive their shots on the schedule. And like ADPH has said, they kind of created this, not really a grading system, but they really tried to evaluate and see who was at the highest risk of catching this disease based on what their job function was. Whether if you're working in an ER, or an ICU with COVID patients, obviously those people are the ones who are going to be at the very top of that list.
Now, we know, again, this was from the Alabama Department of Public Health, and this is a breakdown of where those vaccines are going. We've got half of all the first doses to hospital healthcare workers, 15% to EMS workers, 15% to doctors' offices, and 20% to hospital staff. Now, one question is that 15% going to doctors' offices, and Dennis, this might be a question for you. Is that 15% going to the employees at the doctor's office, or where is that 15%? Who are those being administered to?
And that's a good question. That's something we don't have quite nailed down 100%. They've told us kind of how they came up with the system for tiering people and deciding who went where, but we don't have an actual breakdown of those tiers for who's getting it when. I mean, obviously, their hope and their plan, they're hoping to receive additional shipments of this vaccine in very short order. And I think their plan, with, in addition to the precautions that Lee talked about, making sure you're not giving it to everyone absolutely at the same time, just to make sure that they can work through the staff and get everybody vaccinated as quickly as possible.
Now, I've got a good question here from Tiffany, and she talks about how typically she doesn't see physicians giving vaccines. She sees, I'm sure, nurses, nurse practitioners, et cetera. So, gentlemen, in each of your markets, do we know who is going to be giving out the vaccines? Lee, I'll start with you.
That's a good question. I'm not sure about in the hospital. Just to follow up on what we were talking about a minute ago, I understood up here that the vaccine would go to the physician's offices. The physician would then vaccinate, his or her staff, so that they would be able to continue, providing medical service to the community as it goes along. So that's what we were told up here. The physician would get them, administer them to the staff, just so the offices stay open and things like that. As to who gives them, that's a really good question. There's got to be an expert shot giver out there somewhere, and I assume that's where they'll go.
I think
John, what about you?
Yeah, I think we'll find out more probably tomorrow. As this gets administered, we'll learn more. That's a really good question, but I think we'd be better and be able to answer that a day from now. Honestly. So.
Dennis, what do you think?
Yeah, I think so. I mean, obviously with this one, it's tricky with the Pfizer vaccine because it has to be stored at, between -70 and -80 degrees. So obviously you can't inject that. It has to be, prepared and thawed. So I think this is going to be a little bit more complicated than just your typical shots that, go from the refrigerator to the patient's arm.
And that is what has been the most talked about part of this Pfizer vaccine, and logistical issues. We think about parts of rural Alabama with that drive. You have to make sure you have refrigerated trucks. You have to make sure once the vaccine gets there, there's a place for it to go. And that is why a lot of people are getting excited about that Moderna vaccine that is supposed to be coming up here, approved, and get rolling out here before too long. Now, I've got a question from Jesse, and he asks, is this 40,000, again, 40,950, based on just Pfizer, or does that include Moderna? Now, that is just Pfizer, Jesse. That's just the Pfizer vaccine. And he also says, how would Johnson & Johnson approval change predictions? Dennis, I know you've been following the different vaccines and their development and their process. So can you talk a little bit about the Moderna and then maybe the Johnson & Johnson vaccine?
Yeah, I know more about Moderna, so I can start there. Right now, the Pfizer is the only one that's gotten that emergency use authorization from the FDA. So that's the only one that's being administered right now, unless something changed in the past 20 minutes that I haven't noticed yet. But we are expecting the FDA to grant that emergency use authorization for the Moderna vaccine probably in short order. They released some additional data today about the efficacy of that vaccine. So and Scott Harris, the state health officer, has said that they expect shipments of that Moderna vaccine to start coming in, maybe within a week or so after the Pfizer one arrived. So they don't want to, guarantee that, because, something can always happen. Initially, they were expecting more doses of the Pfizer vaccine than they got, but that's what they're thinking right now, is they're expecting that Moderna vaccine to come in again, before the end of the year, certainly, and that they can start that, because that vaccine, that only requires a -20 degree storage, which is pretty good, and it can be stored in a refrigerator, I think, for up to 30 days at kind of standard temps. So that makes it a lot more flexible. You can kind of take it a lot more places, and that's the one Dr. Harris has said that they're planning to roll out to these nursing homes and to these other facilities, because it's a little bit more forgiving. You don't have to, keep it in that deep freeze until I believe the Pfizer vaccine says it's 10 days. After you take it out of deep freeze, you have to administer it within 10 days. That's the shelf life on that. So Moderna is a little bit more forgiving. We don't know at this point what those shipments will be like, how many doses of those Moderna vaccine we're going to be able to get right here at the beginning. But we do know that they are expecting that to start arriving pretty shortly here.
So we've got just under 41,000 Pfizer. Don't know about Moderna yet. We've got a question from Dana, and Dennis, I think you just touched on this, but she says, will the shot be that cold when it's injected?
No, it will not. That's just for the long-term storage that you need it that cold.
That's a question I think a lot of us have thought about and said, oh, that sounds extremely uncomfortable, and probably more uncomfortable than most of our shots are. Now, Dennis, do we know of anywhere else in Birmingham that's got doses of this vaccine other than UAB?
Yeah, so the VA hospital in Birmingham has also received some doses of this Pfizer vaccine, and they are I don't know exactly when they're going to start rolling that out, but that may actually happen before UAB starts giving out. We're kind of waiting to see who will be first at this point. But that, again, could potentially happen as early as this afternoon or tomorrow morning, that the VA would start administering doses to their employees.
So it's fair to say that within the next, we'll say 24 hours, it looks like we will have vaccines rolling in the Huntsville area in North Alabama, in the Birmingham, Central Alabama, and the Mobile, South Alabama area. Is that fair?
Yes,
That's correct.
I think so, yes.
So again, everybody, this is a very fluid situation. I think that I have probably 40 different texts and calls while we've been on here, and I'm sure all of these gentlemen do as well, about different plans that are changing. So we're going to bring you the latest on AL.com, and you will be able to find on our website where these vaccines are happening, when they're happening, and more. So, gentlemen, thank you so much for coming here this morning, taking some time out of your really busy days and talking about your area. I know I appreciate it. I know everybody watching does as well.
Anytime.
Thank you.
Thanks.
Thank you guys so much. And everybody watching, thank you so much for tuning in. Stay tuned for more vaccine news, and we will see you tomorrow.